All right, so this morning is a couple of things put together because I got this crazy email. Actually, Brandon got this crazy email and sent it to me, um, and just really crazy. So this came from one of our followers, and she said, I just had a text from a friend who was looking for more advice. She had taken her Cavalier to a specialist in Pennsylvania for a consult on dental surgery that was needed. I don't know which specialty practice, but I can find out. I would like to know. Um, the dental specialist said that surgery could not be performed if the dog was being fed grain-free food. Rattled off something about the relationship to DCM, that old topic. Is this a new development in canine dental surgeries, this kind of refusal? Specialist has determined that it's better to let the dog suffer from systemic complications due to not having surgery and suffer pain in the mouth and gums rather than have surgery because of what the dog is fed. Feedback on this one, please. Are you kidding me? OMG. He drank the Tufts Kool-Aid. So, the whole DCM related to grain-free thing is so blown out of proportion, and typical, the FDA posted something way before they had any information, named a whole bunch of pet food companies when we saw their stocks drop and their sales drop. And I'm not defending those companies because I'm not a fan of grain-free dry kibble for our dogs or cats. I don't think that's how they should be fed in general. But the problem with this is that raw pet foods or many of the gently cooked pet foods also do not contain grains because grains are not something that is necessary in the diet of dogs or cats. So we are now telling, I don't want to turn this into politics. We are now telling people that they have to feed the food that we say they have to feed, which I guarantee you this specialist wants them to be eating Purina, Science Diet, Royal Canin, Blue Buffalo. Pick one of the big pet foods that I wouldn't touch any of them with a 10-foot pole for my dogs. That is, or my cats. That is absolutely not what is good for them to be eating. So this is crazy. Now, my answer to this person is find somebody else because that's a veterinarian who absolutely doesn't have a clue what they're talking about. By the way, Cavalier King Charles Spaniels are not prone to DCM, dilated cardiomyopathy, to begin with. They're prone to mitral valve disease, which really has nothing to do with their diet, although they also should be fed a high meat diet, which is going to be high in taurine, high in carnitine, which are the amino acids that they need for good heart health. So I probably would find another specialist because this person doesn't know what they're talking about. The other option she has is she could lie. She could say, oh, okay, I just added grains into my dog's food. I'll call you back in a month. Ugh. Personally, I'd find another specialist. But there are some areas in, central Pennsylvania, western Pennsylvania, where you may have one specialist as your only option. You may have to drive 6 hours to find a different specialist. We went to a dental specialist with my mom's dog in Pennsylvania. He was awesome. And I don't think he even asked what we were feeding the dog. We were feeding her raw food. If he did ask, he didn't care. He didn't try to insinuate his opinions onto us. Maybe he didn't ask because I'm a veterinarian. I don't know. I have no idea. I don't know where they're located because she said it just specialists in Pennsylvania. So, Barb Emmett, if you're watching, we'd love to know what area of Pennsylvania you're in, because our specialist was Hugh. Help me out. Chadsford, Pennsylvania, which is southeast PA, and he was amazing, and part of a specialty group that also has a specialty in New Jersey. So, the whole grain-free diet thing, I've got a ton of blogs on that. So for those of you who are not familiar with it, if you're newer to our page, please go to drjudymorgan.com, put in the little search at the top, the little magnifying glass, put in DCM or heart disease, you're going to get a million of my thoughts on this whole craziness. So the second thing was on the Friends of Dr. Judy Morgan Facebook group. I saw a question somebody posted. I saw it this morning. I don't know when it was posted, but it sparked a huge discussion and everybody yelling at each other on pain medications to be used after dental surgery and 17 extractions being done. I think it was a small dog. So when we did Shayna's dental, when her cardiologist finally said that her heart was strong enough to do it, we ended up with 25 extractions. She only has 4 teeth left. The good news is that, if there's any good news in that, all of her teeth were so rotten and so loose that literally we just plucked them out. We didn't have to dig them out of her jawbone. So it wasn't that it was that painful for, actually, she was most likely in a lot less pain after getting them out than she was with them rocking and rolling in there. If you've ever had a toothache, you know that can be very painful. So the dental procedure is extremely important to get those bad teeth out of there and help the dogs to feel better. And people tell us all the time that once their pet that has a lot of bad teeth, once they have the dental, it's like you turn back the clock 2 or 3 years. They're playful, they feel better, they eat better. They've gotten rid of all that infection, and it makes them feel so much better. Now, here's the thing. So this person said, what pain med should be given? Is Rimadyl okay? Because that's what the veterinarian wants to give. And I will tell you that that's the most common pain med that is given, most likely. Metacam is pretty far up there too, but I think more vets use Rimadyl because it was the first one to the game. So, yeah, why can't people be civil on social media, Teresa? I don't know. This one sparked because everybody has an opinion, and everybody feels very strongly about their opinions. I get it. You know, sometimes I'm very strong in how I word things as well, you know, especially if we're talking about some of the oral flea and tick medications, because it makes me want to rip my eyeballs out that everybody still thinks that they're safe and they're not. Anyway, so this person just asked a question. My vet wants to use Rimadyl. Is that okay? Following 17 teeth being extracted. And there's not the one right answer for that. Do a lot of dogs do really well on non-steroidal anti-inflammatories? Yes. Do some dogs die from the use of non-steroidal anti-inflammatories? Yes. It can cause liver problems, it can cause kidney problems, it can cause GI ulceration. So is that my first choice for every animal that has a pain problem? No. Might it be appropriate in this particular case? It might. I don't know. It's not my case. I didn't do the procedure. Here's the thing. If your pet is going to have a lot of extractions, you want to know what are they doing to preempt the pain, because there's something called wind up. And what we want to do is we want to stop the pain before it happens. If you let the pain happen and then try to catch up afterwards, it takes a lot more drugs, takes a lot longer, and it's a lot harder to do. So they should be giving something pre-op. So in our practice, most of them would get an injection of a non-steroidal anti-inflammatory unless we knew that the pet had a problem with it. They would get Torbutrol a lot of times, which is more in the morphine type family. So they would get stuff ahead of time so that their mouth was already going to be a little numb to what was going to be done if we knew there were a lot of extractions. Now, if it was just a routine dental cleaning with no extractions, we don't need to use all that stuff. So every case is an individual, and you have to decide how much you need based on what you're going to have to do. My mom's dog had bone grown over her teeth. They had to cut through gums and bone to find her teeth. That dog needed a lot of pain medication. So the other thing that should be done if they're going to have a lot of extractions or a lot of oral surgery being done are nerve blocks. Basically, when you go to the dentist and they give that injection in your gum line, that's what needs to be done. So nerve blocks will numb that area and preempt the pain so that when the animal wakes up, If we've done a good job pre-op, when they wake up, they're not painful, they're not screaming, they're happy. And when that starts to wear off, they've got enough stuff on board that they're going to be fine. And maybe then we can get away with using something homeopathic like arnica, or something herbal like the doggone pain, the DGP. Every case is going to be individual. So one person recommended a fentanyl patch. Well, in the right case, fentanyl patches can be used on dogs and cats. They're used quite commonly for orthopedic surgeries. Believe me, if your pet has bone surgery, you are not going to get away with a homeopathic. You are going to need something for that pet. Somebody mentioned tramadol. Tramadol only works in about 20% of dogs. We give it to a lot more, but it doesn't work for a lot of them. For cats, the side effects are so great with tramadol that it's very rarely used. It's also very bitter. They hate the taste of it. So, there's no one right answer to that. And so people start getting nasty with each other, and there's no sense in being nasty. You can have your opinion and say, in my opinion, I would never use XYZ on my own pet. However, might be appropriate for yours. I don't know. That's why we call this integrated medicine. Yes, I'm holistic. Would I prefer to not use nonsteroidals? Absolutely. Would I prefer not to use big drugs? Absolutely. But I have said this for 20 years, and I'm going to keep saying, if I get hit by a bus, give me real drugs. We can work on the natural stuff afterwards, but let me tell you. So, what would I use for torn crucia? Again, depends on the animal. We use icing for those right afterwards. You can use topical analgesia. There are, tons of herbals that you can use. It's probably going to be a combination. Galliprant is just another nonsteroidal anti-inflammatory. It's supposed to be kinder and gentler on the system than some of the other nonsteroidals, but it is absolutely only appropriate for osteoarthritis. It does not help with like dental pain. It is truly an osteoarthritis drug. So when your big boy had TPLO, he was on Rimadyl and gabapentin. That's a pretty common combination. The gabapentin is also a little bit sedating. So it just depends. It depends. So when that dog had a TPLO, there should have been local nerve blocks in that area. They should have put some lidocaine or some sort of local anesthetic in and around that area. So there's anesthesia is not just giving them something to put them to sleep and then giving them gas to keep them asleep. It's also pain management. Anesthesiologists are pain management experts. That's their job. It's not just to get the animal to sleep. It's to get the animal to sleep and keep them pain-free. So, Vetprofin, that is Rimadyl. And CBD, another good pain med. The pain supplement, whatever. There are so many options out there, and a lot of times it takes a combination of things. And sometimes maybe you need that non-steroidal, but you can use it in a quarter of the dose because you're using CBD and arnica or hot packs or cold packs or whatever in addition. So it's multimodal therapy, and it's finding what works best for the individual. There's no one size fits all. So this one had a nerve block that lasted 3 days. Perfect, because it allows you to not use so many of the oral meds that can have so many side effects. So SM flare-up once a year on a calf and acute pain. So when our guys, like August, when we get those thunderstorms that roll in and the pressure changes in the atmosphere occur very quickly, Kristen, that would be the one time of year when our guys would maybe get 1 milligram of prednisone, and that would be enough to stop it. And again, people say, oh, never use steroids. Steroids are horrible. A single dose of a steroid is going to be fine. It's when they have to stay on something like that every single day forever. That's a problem. Even for, weeks to months, that's a problem. And we don't want to do that. So, okay. Gotta go. I gotta go fertilize the garden and put some DE is what I'm using as our natural pesticide in the garden. And we just ordered BT, which is Bacillus thuringiensis or something that kills worms on your plants. We're trying to do stuff as natural as possible. So we're using a natural pyrethrin spray. We're using DE, and now we're going to use this bacteria. So all kinds of fun stuff. Learning, learning, learning. It's amazing what you can learn.